So, Assalamu alaikum. Today we're going to start the types of gingiva. So, what is gingiva? We have studied before that it is the part of the oral mucosa part, and it is also covers the alveolar process. Alveolar process is that the bone that has that basically contains the tooth. We call alveolar bone, and processes of the jaw, and that surrounds the neck of the teeth. We know it. Okay, let's start the types of ginger, which we have divided previous in video anatomically. Number one is, let's start it. Bismillahirrahmanirrahim. Marginal gingiva. Marginal gingiva, unattached gingiva, या free gingiva. They have three names. This name is not that this is, they have just randomly given this name. You can't say that it is a free gingiva line. No, no, they have just given the name. Let's start it. The terminal edge or border of the gingiva. Basically, it is the terminal, like, or it's like a border, I will see, and that's around the teeth in a collar like fission. Collar like fission, like you have seen your parents, your father's collars, like it is just like that, basically. Okay, I can show you that this is, so basically this is your free free gingiva. Okay, this is your free gingiva. Okay, now moving forward. In 50% patients, you can see a shallow like depression, which is called free gingival groove. This free gingival groove is basically a groove that is between the marginal gingiva, or basically it is attached gingiva. It is a groove between the attached gingiva and unattached gingiva or free gingiva. The marginal gingiva is usually about 1 millimeter width. It is very important. They can ask in your MCQ. Why we should know this? Like, it is also important for the probing purposes, so you should know it. It forms a soft tissues wall of the gingival sulcus. You will also see in upcoming videos. I will show you the gingival sulcus. Basically, it forms a soft tissue wall for them. It may be separated with the periodontal prop, which I have tell you. Then we have the gingival zenith. It is the most apical part of the marginal gingiva. Okay, like I can tell you what is gingival zenith. This is the gingival zenith. Okay, the most apical part of the marginal gingiva. And there is also come a word, it is scalloping. The scalloping is basically this pattern called, we call it scalloping. Scalloping, ठीक है? Okay, we call it scalloping. Okay, and it is apicocorner या mesodistal dimensions vary between 0.06 and 0.096 millimeter. Okay, basically this gingival zenith in your interior teeth, in your interior, basically, and in your canines it is slightly distally, this with the long axis of the tooth, but in your lateral incisors it coincides with your long axis of tooth. Okay, like this. I can show you, like it can be like little bit like this, like this is more distally, but in your lateral it is coinciding with the long axis. Okay, this basically gingival zenith. Next we have gingival sulcus. In before video we have said about a word which was gingival sulcus. Let's study about it. It is basically a shallow surface or space around the tooth. Yes, it is basically the covering the tooth, or it is bounded by the surface of the tooth on one side. One side it is basically surrounded by the tooth. The other side it is basically the epithelium that is lining actually the free margin of the gingiva on the other side. So one side is the tooth, the other side it is covered by epithelium. It is v-shaped it. Okay, and it is a diagnostic parameter. It's very important to know. It is diagnostic parameter in case when people have gingivitis, periodontitis. Okay, if you go for the ideal depth, it is close to 0 or 0 almost. Okay, and this is when this is germ free, or there is no plaque control, when there is almost prolonged plaque control intensely. In healthy gingiva, The histological depth is basically founded 1.8 millimeter histological sections में. Then there is a lot of variations like 0 to 6 millimeter, you can say 1.5, 0.69. Okay, there's a lot of clinical examination they have said. The evolution used to determine the depth of sulcus involves अच्छा how you determine it is basically of course periodontal depth. ठीक है. This histological depth do not अच्छा it doesn't mean that your histological depth will be equal to the depth when you are probing it. Okay, so don't confuse it. Okay, and the penetration of the probe depends on three important factors: the diameter of the probe, the force of the probe, and the inflammation. Always remember, when there is inflammation, so they will not resist the penetration of probe. It will easily penetrate into the gingiva. Okay, and basically the normal gingival sulcus for humans is 2 to 3 millimeter. Okay, for histological 1.8 millimeter, very important to. Okay, the diagram you can see, this is very clear, might you can see the gingival sulcus is this. One side it is covered by the tooth, the other side is covered by the epithelium which is actually lining the free margins of the gingiva on the other side. Okay, you can see this is free or marginal gingiva, marginal groove attached, mucogingival junction, you will see alveolar mucosa. Okay, you can see these pictures very clearly. Look at in the normal gingiva in adult, note the demarcation of mucogingival line. You cannot see these lines in many people. Okay, like very rarely you can see it. Okay, this is they have seen. Can show you. Okay. The next we have the attached gingiva. This is basically continues with the margin gingiva. You can say it. Always remember about three things about the attached gingiva. It is firmed, resilient, tightly bonded. Three things: firm, resilient, and tightly bonded to the underlying periosteum of the alveolar bone. Always remember it. Okay. As it has mucogingival junction, it is basically a junction between the alveolar mucosa and the gingiva. Okay, and its width of the attachment is also very important. Okay, then they have other definitions like it is the distance between the mucogingival junction and the projection of the external surface of the gingival sulcus on or the periodontal pocket. It is do not confuse with the width of the scrutinized gingiva. Why? Because scrutinized gingiva also includes the marginal gingiva. Okay, so do not confuse with its width. The width of attached gingiva on the facial aspects different and different areas. Like you will always see in interiors it has the greater width, and it will narrow on the posterior segments because the mucogingival junction and this mucogingival junction which you really seen is basically stationary. So how these changes occur the in attached gingival width? It is because with the age, one thing, and the other is when people have supraerupted teeth. Okay, now they said on the lingual aspect of mandible, the attached gingiva terminates. When you see the lingual aspect of mandible, this terminates at the junction of lingual alveolar mucosa, which is continuous with the mucous membrane, like floor that lines the floor of the mouth. Definitely, palatal surface of the maxilla of the attached gingiva in the maxilla, it is basically imperceptibly, matlab blinds you cannot identify equally. Farm and is resilient with the palatal mucosa. That which one is the attached gingiva or what is the palatal mucosa? It is like you cannot detect it. It is basically like this. And let's move to the interdental gingiva. Interdental gingiva basically occupies the embrasure, gingival embrasure, which you have studied in your oral biology in your previous class. That is basically like in triangular shaped it, or it is interproximal area below the contact point. Okay. Acha, this interdental area in your interior teeth has the pyramidal shaped it, but in posterior it become like a coal. Coal, you have see the tents. Did you have see the tents? Like people have a lot of tents. Like they have tents. I can show you 1 minute. Like it is basically like this. This part is known as coal. Okay, like it basically connects your buccal and as well as your what you can say your lingual side. basically, and it forms the shape of the interdental papilla. Okay, it is like a valley like depression, you can say. It is a valley like depression basically, and basically connects the facial, which I have said, and the lingual papilla that conforms the shape of the interproximal area. And how this shape depends on various points, like it depends on your contact point. Okay, the contact point between the adjacent teeth, then the contact point and the osseous crust. What is osseous crust? So osseous crust is basically, I can, 1 minute, osseous crust is basically, 1 minute, I can show you if in this diagram. Like osseous crust, we have like it is basically the it is basically the distance, you can say, the distance between the contact point and the bone. Okay, then they have said that how will be there recession, or if there is more recession, of course it will affect the shape of the interdental papilla. Okay, then they have said that the facial and lingual surfaces are tapered towards the interproximal. Yes, of course, where the mesial distal surfaces are slightly concaved. They are slightly concaved. Then the lateral borders and the tips of interpapilla are formed by marginal gingiva of the adjoint. Okay, the lateral borders and the tips of interdental papilla are formed by marginal gingiva of the adjoint teeth. The intervening portion consists of attached gingiva. If a diastema is present, matlab diastema is the space between two interior teeth, the gingiva is firmly bounded over the interdental bone. Means to form a smooth round and surface without interdental papilla, means there is no gingiva if there is a diastema. Okay, thank you.